Everybody's live streamed in and tuned in. We're excited to be here on the first full day of the Housing Alliance Conference and the second day of the annual Homes Within Reach. I think that we all wish that we were within reach. And, you know, one of the things that I love most about the Housing Alliance Conference is an opportunity to really see some old friends, make some new friends, see colleagues that I haven't seen in a long time and really connect. So I know that we're all honored to be here virtually. We're glad that people are well and healthy and safe. And we look forward to 2022 or maybe 2021 when we can get together again. Good morning. My name is Kathy Possinger. I am the director of DCED's Center for Community and Housing Development. I'm thrilled to be here with my colleagues, Dolores Culligan and George Payne, and we're talking today about advances in emergency shelter and drop-in services during COVID-19. And this is certainly a challenging time for so many that are working intimately in housing provider services, homeless services across our communities. And we are honored to be here with you to talk a little bit about some of the creative resources that have been developed across Pennsylvania and hopefully trigger some conversation with you all about opportunities for those roles. Just as in the way of introduction, as I said, my name is Kathy. Part of the role that we play at DCD and the Center for Community and Housing Development is the lead for Pennsylvania's allocation of HUD funding for the Community Development Block Grant, Home Investment Partnership, Emergency Solutions Grant, and a host of other resources, including HOPWA, Housing Trust Fund, and of course, the recently allocated CARES Act resources through CDBG and through HOME. DCD in this capacity also plays a role as the lead of the balance of state continuums of care in the eastern and western communities of Pennsylvania, where we cover 53 counties in our work as the collaborative applicant and partner with the continuum of care leaders across the Commonwealth. DCD also provides a role as the HMIS lead in that capacity as well. Where as an agency, the department is intimately involved in the state's long-term recovery task force through community and capacity building, through the recovery support functions, through business assistance, as well as housing. I play the role with the recovery task force as the lead for the housing support group, and we're actively engaged with DHS, Department of Human Services, and PEMA's sheltering task force to ensure that we're developing the tools and the resources to assist communities in their response during the pandemic, but also in addition to immediate response, also looking at long-term recovery. What does recovery look like in a pandemic where we are seeing a constant shift between recovery and response? It's a struggle that we've had as we've seen surges in cases, as we've seen new and emerging needs, as the trends have shifted over the last several months. We have been actively engaged in these services since March and continue our efforts, and will continue moving forward as well. DCD, as I mentioned, as we've integrated some of our programs into response for the CARES Act and with other resources, we've really looked at ways that we could shift our programs, whether it's through changes in our emergency solutions grant eligibility requirements, suspending some of our pre-established program minimums and maximums for shelter, for rapid rehousing and homelessness prevention. We wanted our community grantees to be able to respond quickly to the emergency and positioned our programs to be able to do that as quick as we could within the required participation, citizen participation and HUD requirements of those programs. We've also been charged with the rollout of the Emergency Solutions Grant CARES allocations and the Community Development Block Grant CARES allocations of funding. In response more recently to critical needs that were identified across the Commonwealth in winter sheltering, DCED launched a targeted use of our Emergency Solutions Grant CARES funds to target what we called Code Blue, and issued a request for proposals and funded nearly $3 million in direct assistance to providers to be able to address their winter sheltering needs, whatever that looked like, within the guise of HUD prescribed program requirements, of course. And just last night, DCED rolled out the final request for proposals for the final tranche of funding for the Emergency Solutions Grant CARES allocation. That's about $16 million in available resources, with a deadline of February 26th. 2021. So please keep that in mind. DCED is planning on hosting a webinar. It's scheduled for tomorrow, and I know that it runs current with probably many exciting sessions here at the conference. However, our webinar will be recorded and we'll have an opportunity to be able to view that as well, and we can direct link you to those resources. We certainly want to provide every opportunity, and the extent of time that we've offered in response to this RFP is principally an opportunity for communities to really work with subrecipient partners who can help to address some of the inequities, some of the disparate populations that have been impacted most greatly by the pandemic, and look for avenues to be able to address those critical needs and identify potential subrecipients that might be able to help with addressing those needs as well. We all know too, the COVID response in the last 10 months have exacerbated the inequities that already existed in our homeless system, in our housing system. We've seen our systems strained. And as such, we've gone on, as the pandemic has moved along, we've challenged relationships, but we've also helped to forge new ones. And the challenges that many communities have faced have resulted in some amazing creativity and resiliency that we have seen. So as such, I am thrilled to be here today with my colleagues, Dolores Colligan and George Payne, both of whom I've known for a very long time. And we're pleased to hear from both of them on how they've adapted to the changing climate in their communities, and structured some resilient responses to meet the needs of our most vulnerable Pennsylvanians. So with that, I'm going to turn it over to Dolores. Let me introduce her briefly, and then we'll look forward to hearing from her, and then George as well. So Dolores Colligan. Dolores has been the Deputy Director of the Chester County Department of Community Development for 15 years. Prior to her current role, Dolores began her career in Chester County government in 1990 as an executive administrative assistant for the Redevelopment Authority of Chester County. Since that time, Dolores has held positions as administrative assistant and program coordinator for the housing and construction in the Chester County Office of Housing and Community Development, and as the community services manager and now deputy director within the Chester County Department of Community Development. Dolores holds a bachelor's degree in organizational dynamics from Immaculata University. We're thrilled to have her. Dolores, thank you so much for being here.
Thanks, Kathy. Thank you for that introduction. And I'm happy to be here with you and George and everyone else who is in our session this morning. So Chester County Department of Community Development, as Kathy said, have been with the county for 29 years, the last 15 in the capacity of Deputy Director for the Chester County Department of Community Development. For those of you who don't know much about Chester County, we're located in the southeast region of the state, within the Philadelphia metropolitan area. We have a population of 525,000 folks. There are 73 municipalities within the county, consisting of 1 city, 15 boroughs, and 57 townships. We are the wealthiest county in Pennsylvania. Our median household income is currently $99,119,000 and a median property value of $367,800. Our home ownership rate is 74%. Even though we're the wealthiest county in Pennsylvania, poverty and homelessness are still very present, with an estimated 30,598 people, or 5.8% persons living below the poverty level, per the American Community Survey of 2019. Our median rent is $1,393 a month, And there is a extreme lack of affordable housing in Chester County, as evidenced by the fact that 41.3% of our renters experience housing cost burdens. So just to kind of give you that perspective of where we are. Okay, and now my screen is not advancing. There we go. So we have our challenges and our mission, because of the funding that we do administer, is to provide housing, neighborhood improvement, workforce development, social services to the residents of Chester County, so that they can live in a community that is safe, stable, and diverse, and of course desirable. We administer federal, state, and county funds to address these needs: affordable housing, homeless assistance, community and economic development, job training, and provide career services at our PA Career Link. Chester County annual budget is normally anywhere $16 to $18 million, but with the CARES Act, we have probably doubled, if not tripled, that budget in the last year. I wanted to highlight, since I mentioned here that we have the workforce development initiatives right out of our department. We are unique in that we are the participating jurisdiction and entitlement for all HUD activities, but we also serve as the workforce development administrative entity for the Chester County Workforce Development Board. And our director, Pat Bakovitz, not only serves as our director, but the director of the Workforce Development Board. Therefore, our funding resources include these different funding resources in workforce development. And because of that, those resources, we have a very unique partnership in Chester County with our PA Career Link, and a partnership where we are under one roof with the United Way Financial Stability Center. And that great partnership has been in effect now. We're going into the 6th year. We celebrated 5 years last year of this one stop. It is recognized throughout the state as a best practice, and I believe one of the only ones in the whole state that has this co-location of services under one roof. As you can see from this slide, the 4 key service areas that we support in that center is income supports, employment, education services. We are the only GED preparation and testing site in Chester County located under that roof. Because of the United Way Financial Stability Center, we're able to have a financial education of up towards 20 different financial education and counseling partners, as well as our Career Link staff under that roof. Because of COVID, we is not open, but for appointments. But before COVID, we had up towards 200 people a day moving through the center. Obviously, that capacity is lower. Everything is online. All of our training hasn't stopped. It's all online. We're getting great participation in that, but there's nothing like seeing folks face to face, as you all know. So moving on, as I said, we are the participating jurisdiction for all federal funds coming out of HUD's Office of Community Development. We receive, as you see here, all of the HUD funding for continuum of care program assistance and community development block funds, home funds for the development of affordable housing. We also receive significant funding from our state. Thank you, Kathy. In the way of our community services block grant. We apply for discretionary funding through DCD. We are administering FAIR funds for the last several years, and we administer local county funds, our housing trust funds, and we are also responsible for administering what we call the community revitalization funds from our Chester County Commissioner's Office, which is bond funding that supports our 15 boroughs and the city of Coatesville for urban and community development. So what do we fund? All of that funding goes into these types of services. Our housing and community support services include rental assistance. We have an emergency rental assistance, what we call our traditional emergency rental assistance program that has been running for years. The eviction prevention court program is something that I wanted to highlight that only just started in September of 2020 with an organization known as Friends Association for the Care and Protection of Children, Jennifer Lopez. I know if you're interested, I believe it's tomorrow morning. One of the affinity sessions is about this eviction, and Jennifer will be highlighting this program in more detail. But in response to the moratoriums and the wave of evictions that I think most of us may be expecting, this is a pilot program that has been very well received here in Chester County. As I said, started up September 2020 with one court in Downingtown. We had been made aware that there were 2,500 eviction filings in Downingtown, and that's where Friends started with this program. As of January, 2 more courts have been added in the city of Coatesville that will cover the city of Coatesville and surrounding municipalities of the Coatesville Area School District. To date, just with the court in Downingtown, 31 families were saved from eviction with an average cost of about $4,000 of investment in each of those families to be able to stay housed. We're paying rent arrears as well as utility arrears, because as you know, many times if you are way behind on your utilities, that can also cause an eviction. Our rapid rehousing programs are funded through our continuum of care funds. We receive up towards about 1.6 million in continuum of care funds annually. We are at a hold harmless. Everything is just under renewal. There's no money available for new projects unless we reallocate, as many of you may know what has been happening over the last couple of years with that funding stream. Our homeless prevention and diversion programs, a housing locator program that is administered by our housing authority, financial management and budget counseling activities, as well as permanent housing stability case management program. Our homeless services that are funded through, again, those resources, we have a 2-on-1 coordinated entry system. I'll get into that a little bit more a few screens from now. We are a single point of entry coordinated system. We fund 6 shelters in the county, I'm sorry. And of course, permanent supportive housing through continuum of care. We no longer have any transitional housing under our continuum of care program, but we do fund some transitional housing. Still, our DV, our domestic violence, has some transitional housing that we support through Human Services Block Grant and HAP funds. Critical time intervention and acute homeless case management. Our targeted population coordinator was something new that we started up about 1.5 years ago, specifically to work through our case conferencing that was implemented in April of last year, and to work with our Built for Zero collaborative in ending chronic homelessness. So again, I'm going to get into that a little bit more. And the data and homeless street outreach team. We're very proud of that, and I'll talk about that too. So those homeless services and even the housing and community support services that I just outlined all support our initiative to prevent and end homelessness. And in Chester County, the term or the name that we've given that many years ago, when we were all told we had 10 years to end homelessness, was Decade to Doorways. We are currently working with our consultant, and I'll get into that. And there will probably be some rebranding of that name as we work through our strategic plan in the next couple of years. But currently, Decade to Doorways is the Chester County initiative to prevent homelessness. And as you can see, what our mission is to maximize current resources and develop new ones with the goal of preventing and ending homelessness in Chester County. We've been probably working at this now for about 7 to 8 years. So what does Chester County's Decade to Doorways coordinated entry system look like? I hope you all can see this well enough. But as I mentioned, we have a single point of entry system. Last year, we contracted with our United Way, who manages the contract for the 211 call center contract that we have. All folks experiencing literal homelessness would call 211. Depress the prompt for 2, homelessness and housing resources, and the process would begin. A short assessment is conducted to get down to the information to see if someone is literally homeless. If the questions answered do support evidence of literal homelessness, 211 will make that referral to a street outreach team who will be deployed to meet with the folks face to face where they are to verify the literal homelessness. Prevention and diversion is practiced at every point of the system. 211 call center call takers have been trained on prevention and diversion tactics. If street outreach does verify that there is literal street homelessness, before COVID, if there were availability in our shelters, there would be a direct placement into shelter, sometimes directly into permanent housing if that was available and the persons were eligible. At all points, housing location services are offered through our housing locator program. And once permanently housed, we have those housing stability case management programs that we're supporting to help people be successful and stay in housing. And then that little cloud you see up there in the right-hand corner captures the HMIS and what we call in Chester County, our Chester County Client Information Management System. And all of the providers working within this system are entering the data into the HMIS so that we have a real-time snapshot of our shelter population, permanent housing placements, and so forth. So our emergency housing inventory pre-COVID during the week of March 16th looked like this. We have 3 family shelters, one of which is our domestic violence center in Chester County. Their bed capacity is plus or minus 39. As you know, with families, you reconfigure as they present. So we could be high, low in that bed capacity, depending on the families that are housed. And on our daily census poll on March 18th, we had 12 households housed in shelter. That's 47 people that we had. In individuals, whoops, trying to advance my screen to see here. Let me move this. Individual shelters include 3 here that we fund. 3 of them all provide shelter for individuals, men, single men, and only one of those 3 provide beds for women, 20 beds for women. That's the only shelter that we have in the county that provides shelter for single women. So you could see the bed capacity here pre-COVID. And on the 18th in our daily census, we had 55 individual shelter. All 20 of the women's beds were full, and the men were at 49. So what happened? The stay-at-home orders were issued, and some key dates that impacted our work in Chester County and the resiliency I suppose we had, and what the title of this session is adaptation. How did we adapt to this sudden change in everything that we did? So on March 23rd, Governor Wolf and Dr. Levine posted the stay-at-home orders, and that was to 7 Pennsylvania counties, which included Chester County. Between March 23rd and 25th, our Chester County Health Department ordered that all congregate individual shelter facilities had to reduce their capacity to stay safe with the COVID-19 pressure that we were under. At that time, we started to move all of the individual shelters that were congregate out. The folks were all moved into hotels that were subsidized by the county. We even provided the transportation to the hotels through our paratransit system. They deployed buses to the shelters and actually transported those folks and their belongings, those who didn't have cars, to the hotels. Our non-congregate family shelters, they all have individual rooms. So throughout COVID and still as of today, they've been able to maintain camp capacity. But they were at full capacity when COVID hit. So any new families presenting homelessness had to be housed in hotels. April 27th, in answer to this, now we said we had a great opportunity. We had all of our folks who we know to be homeless in basically one place. These folks were placed into 3 different hotels. But we saw an opportunity here. We had been talking a lot about implementing permanent housing case conferencing, and we just weren't getting there. We are a Built for Zero collaborative community. We started working with them late 2019. Again, 2020 kind of stopped all of that when we were supposed to start and reconvene late in the mid part of 2020. But we took it upon ourselves, and my director charged me with developing policies and procedures for case conferencing, which we did, and we released on April 27th to start case conferencing those folks only that were in the hotels. As you know, it's a very expensive ticket to hotel folks. So we wanted to use that money to permanently house as quickly as possible. And so this effort was implemented on May 1st. Our first weekly case conferencing began for the hotel residents only. On July 1st, our hotel inventory was at its peak with 101 people housed between 3 hotels. The key dates continued. Well, you know, nothing is ever perfect. And we had a great emergency occur during COVID in Chester County. On July 30th, there was a massive fire in Pottstown on the Chester County side, because again, those of you who don't know Chester County, Pottstown is at the very northern part of the county, and it crosses over the borders. Part of Pottstown is Chester County, and the other half is in Montgomery County. Well, the side of Chester County experienced a great fire. Ashwood Apartments, there was over 50 apartment units burned down to the ground, not anything left at all. And 94 people and 48 households, were displaced and made homeless. We mobilized our staff and many different community nonprofits and faith-based organizations in the northern tier, and DCD in the county again stepped up to the plate and provided. All these people had to be put into hotels. They had no place to go. And so we added to the inventory of folks in hotels at the time. Because of the community, as I put here, the community nonprofits and faith-based and other organizations provided the boots on the ground support. You know, of course, the American Red Cross was there for 3 days, but after that 3 days, our community stepped up, started case conferencing, donations galore. We provided the infrastructure, and one particular nonprofit, Open Hearth, took the lead in starting case conferencing for just that subset of folks, separate from the case conferencing that I just spoke about. The community stepped up and landlords offered apartments and units for these folks, and a total of $145,000 in donations was raised to support the displacement of these residents. Each things like moving cost assistance, for security, first and last rent were provided for these folks. Only about 6 households had renter's insurance. Everyone else did not. To date, 36 households have been permanently housed, and there are still 12 households actively looking and are being sheltered in hotels. So September 17th, case conferencing then, we included now, as we had been moving folks out of the hotels into permanent housing, we included now the folks that were in the shelters. And so we expanded our case conferencing to everyone that we knew that was homeless now, those that are still hoteled and those that are in emergency shelters. So since the beginning of all this, March 25th to the 30th of December, we've served 323 people in hotels. So what were the outcomes from that emergency, what we call our emergency hotel motel voucher program, and the case conferencing that started on May 1st? And so through May 1st to 12/31, we have permanently housed 51 people. Of those 51, 26 self-resolved. Total exits to homelessness because of non-compliance, no movement in working with us. 23 folks exited to homelessness. 13 of those with no subsidy, 10 with a housing subsidy. Through case conferencing, they had been case conference. And when I say housing subsidy, our housing choice vouchers, Section 8 vouchers, we have a very strong relationship with the Housing Authority of Chester County, and they allocate monthly an average of 5 to 6 vouchers to this particular case conferencing. So that as we case conference and we see someone is eligible, we can actually match the voucher to that that person right there at the case conferencing. Housing Authority is on every call and does that triage with us. We currently still have folks in hotels. Well, you see here this little coding down at the bottom. We have 16 households in hotels still. Group 1 means that they are enrolled in a housing program. 7 of those 16 or enrollment is pending, 9 of them, and 5 of them have a unit identified and they're pending approval of that unit under inspection, whatever. Group 3 means that there's been no housing resource yet matched to those folks. So we have 17 households still that we are getting through case conferencing, maybe still gathering information and whatnot to be able to make the right decisions for them and place them with the appropriate resources.
Just another minute or two, Dolores.
Okay, I better move quickly. So current housing emergency inventory, I might need a little bit more. This is what we look like now. Again, family shelters have been stable. However, we've lost 56% decrease in our individual shelters because of the congregate settings that they have. And currently we only have 12 individuals sheltered, or as of December 30th. So we're only at 77% capacity because most of our individual shelters are requiring COVID testing and a negative test result. So that takes up to a week in some instances to get that. So how did we adapt with all of this? August 18th, we released a RFP for non-congregate temporary housing. We will support acquisition, rehab, and operations. This RFP is asking for that should say actually 40 to 50 individuals at one time, non-barrack style. Where we're at right now is we have received one proposal back. We are in communication with this provider almost weekly. We've identified a building. We are in communication with the municipality. There are structural inspections being done on the building, and we're close to be making an offer for acquisition. We're working with private funders to support ongoing operations. How did we adapt further? November 2020, we found that over the last several years, we've always subcontracted out our street outreach, and it just wasn't working for us. So we created a new team of a county staffed employed street outreach team. And the complement that we have now is a data and street outreach manager, lead coordinator, 2 street coordinators, and a data entry coordinator. This team was deployed to the street on December 23rd, and they've been doing a remarkable job. We've already seen a data quality increase and better homeless verification. So I've been told that they're an awesome team and doing a wonderful job. January 2021, we just started in the midst of all of this last year. We were in negotiations to start transitioning from our current HMIS system to a new application. And so just this January earlier, we started our elicitation phase to work towards migration to a new HMIS. And we intend to fully implement our new HMIS application by June of 2021. And then finally, we are undergoing an 18-month road to recovery. That was some term that Kathy used in the beginning, and I didn't even share this with her, so we kind of aligned there. Since 2019, we have contracted with Jason Alexander from Capacity for Change. Jason lives in Westchester, Pennsylvania, not far from where we work, and has been a great partner of ours, not only a resident, but a great partner of ours for a very long time. And our ongoing consultation work through 2021, 2022 with Jason will include these outcomes: successful implementation of our 18-month recovery plan. He is helping us with our implementation of HMIS transition. We are going to the Ecovia Client Track platform. And during this time, over the next 2 years, we will be developing a 5-year strategic plan for preventing and ending homelessness. So with that, I thank you very much for your time and attention. And I guess after George presents, we'll be very happy to answer any questions that you have. Thank you.
Thank you so much, Dolores. We really appreciate all the great work that you're doing in Chester County, and it's evidenced by the real interconnection between so many teams.
Thank you.
So it gives me pleasure to introduce George Payne. George is the Director of Projects with the Harrisburg Redevelopment Authority. And as such, HRA serves as the Capital Area Coalition on Homelessness for Harrisburg and Dauphin counties as the COC lead. George has worked in the housing and homelessness field for 24 years, including 17 years with the YWCA of Greater Harrisburg, creating and overseeing housing and outreach programs. And in his capacity with CASH, he performs many of the planning, data collection, and program consulting performances. So CASH has played an essential role during COVID in developing shelter policy and resourcing, fund mapping, and continuation of essential services. So I'm thrilled to hear that we'll have George sharing some insights with us about the work that CASH has been doing. Thanks, George.
Thank you for that introduction, Kathy. All right, I'm going to share my screen here. Okay. So Capital Area Coalition on Homelessness is the lead agency and collaborative applicant for the jurisdiction of Dauphin County and the city of Harrisburg. It represents a coalition of over 80 agencies, officials, civic, private providers, various medical, various agencies and individuals, all invested in ending and preventing homelessness. Our mission is to educate, mobilize, coordinate all our partners to the mission of preventing and reducing homelessness in the county and the city of Harrisburg. There are about 28 or so different housing and homeless programs in the city. In the county, I should say. And the county's about 278,000 person population, turned 78,000, and the city of Harrisburg is about 50,000. Our point in time shows that there's about 426 persons in a given 24 hours who are experiencing literal homelessness, either unsheltered or in a temporary shelter or temporary housing for homelessness. We've anticipated that about 100 to 130 of those who would not be in winter overnight shelters and things like that are actually unsheltered in tents or sleeping on the streets or in abandoned buildings or in barns or different things like that. To address those, we have various programs. We have multiple emergency shelter and continuum of care rapid rehousing programs, domestic violence, emergency shelter and transitional housing, and homeless prevention programs. We have a couple of transitional housing programs still, not funded through HUD, but through other sources, a safe haven, as well as, of course, permanent housing, shelterless care, multiple permanent housing programs, HUD vouchers, Section 811 mainstream vouchers, and 811 project rental assistance vouchers, dedicated for homeless and chronic homeless persons experiencing those types of homelessness. We have 4 shelters. Only one of them is a men's shelter, and that's the major and only men's emergency shelter here in Harrisburg. And the others are for women or women with children. We have outreach teams, which are very specialized. We have mental health and PATH outreach workers, a youth outreach with Valley Youth House, and a Synergy project, veterans outreach with the YWCA and Lebanon VA and Volunteers of America, as well as veterans housing programs with SSVF, Veterans Work Program, HVRP, and of course HUD-VASH housing. We also, have a coordinated entry system whereby there is a hub as well as outreach teams that are the coordinated entry points of contact, as well as 211. And help ministries, Christian Churches United Help Ministries, um, does the coordinated entry, the bulk of the coordinated entry services, the shelter referral, and most of the rapid rehousing and homeless prevention, as well as the CARES Act rapid rehousing um, intervention. So that's good because it's very centralized in one agency that has been able to well handle a lot of the hotel placements, a lot of the rental assistance and homeless prevention activities that have been critical during this time of the pandemic. Um, all right. So during the pandemic, uh, during the shutdown that started about mid-March and kind of lasted till the end of July. During the COVID pandemic shutdown, basically, not only did businesses and families and all of us shut down, but those who experienced homelessness unsheltered, their world was also shuttered and drastically reduced. Um, Places that soup kitchens and places that served meals stopped, or else had to provide curbside options that were not enough for persons who are um, unsheltered because of the rigors of living outdoors. Whereas there were public restrooms available at certain places, there weren't any available anymore, um, nor were there a means of obtaining potable water. There was no access to places that offered showers in previous times, no means for laundry, which meant more need for clothes, disposable clothes. Access to computers, internet, and to connect to the world or to main resources closed with the closing of the library, primarily. Most importantly, health and street outreach services, medical appointments, substance abuse counseling, uh, even housing and homeless outreach abruptly ended or had to transition to telehealth or telecommunication. But 2/3 of those who were unsheltered did not have a phone or a way to charge them. So their world just shut down with everybody else, and the need was dire. So Cash and its network organized with the municipality, emergency management, the city, and the county to make sure basic needs were accessible. And we tried to make sure that these basic needs were provided at venues where it was safe, where we practice social distancing, and whether it's outdoors or indoors, practice social distancing and spacing and all the with PPE and all the screening processes, so that outreaches can also begin to do face-to-face contact. So we would try to tackle two things with one solution: meet basic needs and provide the venue for outreach to start up again. Um, so well, let me back up and say, when we started, we were with the rest of the country. Nobody really knew how to handle this. Of course, we had plans for fires and we had emergency plans for everything but a stay-at-home pandemic. Um, and so it was a learning curve for everybody. But the good thing was it made us communicate frequently, together, and often. Um, and that was one of the silver linings of the whole pandemic. It really brought our network together through the crisis, and that has been continuing till this day. So one of the venues that we needed to meet was showers. When we interviewed people, they're like, "Man, we haven't had showers for a long time. We need clothes." And the YWCA, the showers were offered at two places: YWCA and at a day downtown Daily Bread, which was a day center. And YWCA shuttered and closed, although it had residents. So we worked with the local YWCA downtown to figure out a way of uh, triaging people, um, testing, temperature screening, them, and making sure that cleaning protocols, PPE, and all sorts of protective measures were in place in order to reopen showers in a safe way and a coordinated way. So in order to do that, we needed volunteers to to do the testing, to do the escorting, to do the crowd management and the cleaning, and so forth. And Volunteers of America is their medical screening unit, as well as Department of Human Services volunteers from the VOAD volunteered to help provide for these showers, which occurred Monday, Wednesdays, and Fridays. And they occurred in the mornings from 9 to 12. We had groups of 8 people at a time take showers for no more than half an hour. So we did groups of 8 people at a time. The volunteers did. We also had donations, and the volunteers did the screenings, the medical screening, temperature checking, asking COVID-related questions, as well as any health-related questions. And everybody was provided with PPE and hygiene supplies. So the men's showers were spaced out in between, so we had a stall closed in between each stall to try and, as much as possible, space people out. And five men could shower at a time. And we sanitized them, and we sprayed them down after the stalls after each use. There were private shower stations for women and as gender neutral options as well. So for up to two women at a time, or persons who needed a private shower, private shower as a alternative instead. And they were they were accessible, and had accessibility options. There was staging and social distance area where people could leave their belongings and be escorted as a group at a time to the showers. So as I mentioned, we have probably about 100, maybe 130 persons who are unsheltered in the city, and they primarily reside in 2 large encampments. Under a bridge, a major bridge in Mulberry Street in Harrisburg, and near the PennDOT by the riverfront and the Greenbelt and in Harrisburg. And then there's a number of people sleeping at various places throughout downtown, as well as maybe in abandoned buildings and things like that. During the winter, many of them are at our overnight shelters. So this emergency EMA, the city provided porta potties by the encampment sites as a way for providing for those needs. So there were 2 encampment sites, and this one was downtown here. Even the downtown businesses also provided porta potties, even though they were shuttered. The Downtown Improvement District decided that's something that they needed to do, and so it was a wonderful private public partnership there. Fire hydrants near those porta potties and those sites were fitted with spigots to provide potable water. Chief Enterline, our fire chief, fixed the spigots onto those fire hydrants. And there's an example of it. So that addressed the drinking water issue. And then another venue then for outreach was we gathered all the different outreach providers and said we would do a joint morning outreach in an outdoor venue right next to one of the encampments. And so we parked right outside the encampment where there was a space that wasn't being used, a large space. And we had all the outreach providers. We had UPM Pinnacle doing their health outreach, veterans outreach staff from the VA and the YVCA and Volunteers of America, And all these various specialized outreaches, they all, we all talk to each other, but we all have very specialized target groups. But being located together as one, we were able to um, case conference together and to really work seamlessly as a group, meeting the multiple needs that various persons in the encampments had. Help ministry that I mentioned that did a lot of the housing, the rapid rehousing and shelter referrals, as well as they organized Compassion Action Network of faith-based agencies that did a lot of feeding separately, and they brought them all together, to coordinate and not duplicate. They were there at the site providing um, clothing, resources, as well as housing, outreach and placement into coordinated entry for permanent housing. They Dauphin County Library had a mobile van that was able to bring a hotspot and cell phone charging to the site. And so we were able to work with people who needed to connect to, for mainstream resources, for instance, through Compass or what have you, or who needed just to charge their phones. And we also did a cell phone drive for people. And at that time too, we had a tax preparer help people access their rebate, their stimulus check during that time, and so connection to hotspot and wireless services was important for that.
About 2 minutes, George.
Oh, really? Okay. Salvation Army, Bethesda Mission and Salvation Army brought food to the encampments too. That's a week worth of food. So here's the one-stop outreach of multiple agencies. I'm just going to go quickly. A lot of good pictures. A little grainy, but and so we worked out of the back of our vans and on tables and under the bridge when the weather was inclement. And this is the other PennDOT outreach site. And so we had meals, clothing, downtown daily bread. We were able to open up the center and make that the center for a lot of the donations. And so what we also had to do was we had to do a system of referral for the shelters, and this, we had to come up with a plan of how to triage people and what to do with people who needed quarantining, isolation, and placement in hotels when there was no space in the shelters, which had to be reduced. We also had to figure out how to use different funding sources for that, from ESG to FEMA Category B, which has their different categories of eligibilities. So the results, and I'll end with this. During those 3 months of the shutdown, 650 showers were provided to 160 different people. UPMC nurses and 16 to 17 Medical Wellness Reserve Corps provided screenings, medical home, and primary care options at the showers and Thursday outreach site. Mental health, path, and crisis outreach were accessible to many consumers. Downtown Daily Bread doubled their laundry program and increased their volume of clothing donations. Salvation Army provided 450 boxes, about 600,300 meals through their distribution. Housing, Help Ministry, Outreach, and Housing Specialists were able to enter 54 of the unsheltered homeless individuals into coordinated entry wait list, and during that time placed 7 in permanent housing. Mainstream benefits, several persons were assisted with SNAP and other mainstream benefits, as well as unemployment, identification, and disability income. Help people get 15 people get used phones. Helped 50 individuals access their stimulus and tax refunds. 7 veterans engaged and 1 was housed. 12 homeless youths were identified and served through Valley Youth House. And the library services provided hotspot and cell charging, laptop, and sanitizing supplies to 260 people in the community as they parked at those 2 outreach venues. And this is just a list of the agencies that participated. I'm not going to go through them, but they're basically, private, public and faith-based agencies all working together. And that was the beauty of this whole thing. And it continues to this day. And that is the end of my presentation. Thank you, Kathy, and everybody.
Thank you, George. And thank you very much for that great overview of how you've been able to be adaptive and also resourceful. And I know, having benefited from the analysis that you and your team provided of the different funding categories, and we were able to share that information with colleagues across the state through our sheltering task force and RSFs. So we do have a couple of questions that have popped up in the chat, and hoping we can go through those. And I apologize, I'm not sure if we get a hard stop if Brian or our hosts actually cut us off at 10:30. But the first question was about availability of slides, and I know Dolores has already shared hers, and I'm hopeful that George can share his as well.
Yes,
thank you. And I think those will be available through the Housing Alliance as they typically are. So the first question is, what happens if someone needing housing tests positive for COVID? Have you had experiences with that? And what's the plan for those folks? And we can, Dolores, if you want to take that one, or George, whichever.
Yeah, I mean, we might have the same thing. I know here in Chester County, to date, we have had, I think, 5 to 6 folks test positive. They are referred, when someone tests positive, they're referred to the Chester County Health Department. We have the privilege of having a health department. Not every community has, or county in Pennsylvania has their own health department. So if they're alerted to the health department, that they're positive. We have a contract with a medical transportation service that will go pick up the person so that they're safely transported to a motel that we have an arrangement with, a motel that, you know, you could just, the door, you just walk into the room. It's not a congregate type of comfort inn. It's one of those, you know, motels. So we have housed about, I think to date, 6 people at that hotel sporadically, you know, throughout. I think at the height, we had 3 folks at one time. That was probably back in the spring when, you know, everything hit pretty hard. So that's what we've done.
Great, thank you.
Yeah, similarly, we've had 4 or 5 people who had tested positive, not necessarily in the shelters, but needing shelter. Although, no, there were a couple in Safe Haven that did. And in my slides, I have a little map of how we triage people with that, but it's similar. We have 2 hotels that said they would take COVID positive patients. And of course, we refer them to the health system and involve DOH in it.
And those folks in our system, they're case conferenced. So they will be, you know, they've included to the inventory, the roster of those to be case conferenced. And also we provided food for them for the 2 weeks that their food boxes, our food bank has been very generous. And every Tuesday and Thursday, our street outreach team goes and picks up a multitude of food boxes. Each box, I believe, lasts a week. And those are distributed to everyone sheltered in hotels. So just to give you an idea.
Thank you. Thank you both. We have one other question. You know, Dolores, you had mentioned, you know, being an arm of county government, how your county budget has swelled.
Exploded.
Exploded. But I imagine that, you know, across the board and with some of your providers, that's likely not the case. So to both of you, how has the crisis and your responses affected your budget? And you know, is there more help that's needed from the state or from others to be able to address these critical needs with emergency sheltering?
Okay, well, I'll begin. The provisions of the hotel costs and everything, you know, as long as you follow the eligibility rules of each funding source, that was you know, that was adequate at this point. But you know, there were a lot of waivers that were passed, but some of the waivers didn't address planning costs, administrative costs, which was a bulk of what had to be done. And so those things, you know, had to be taken care of through unrestricted funds and different, you know, charities and things like that, donations. And of course, there, there is probably not enough homeless prevention dollars, especially with this upcoming eviction crisis that we may be looking at. But right now, the CARES CARES Act was sufficient and helpful, and the funding from the county and the city and through HUD and PHFA and things like that.
Yeah, I would agree with George. Right now, we're stable. We have put out 2 rounds of CARES Act fund RFPs because we are funding administrators in my department. So we have released all of our CARES Act funds now to our nonprofits in 2 separate rounds. The second CARES Act awards are going out now. Those contracts started as of January 1st. The hotels in the beginning, our health department received FEMA money. So that first round of housing and hotels, we expended the funds out of our CARES Act funds, but we were able to be reimbursed about $150,000 from the FEMA money that our health department had received. To date, we've probably spent close to $500,000 in hotels, and that's why we need the non-congregate. We can't keep on keeping people in hotels. And so the translation of that funding hopefully will then go to the non-congregate shelter, which based on, being a very high vulnerability population, the chronic homeless, the clinical services and whatnot, it's a pretty hefty ticket item. So we'll be transferring those funds there. We're always looking for funds. We're always applying for discretionary. We're always developing new programming. We're always trying to be innovative and creative. So right now we're good. All of us that funders in our community are talking about, well, after this wave is gone and all this money is gone, how are we going to sustain some of these changes? So, we're always forecasting into the future. We're good now, but what's it going to look like in 9 months from now or a year from now once this next this next act and the funding, we all reset to normal. What is normal going to look like and how are we going to sustain what we've put in place moving forward? So, but we're good right now. So that's what I would say with that.
Thank you both. And, I think as in my role, one of the things that we look to is, how do we look to that new normal and what's that going to look like? And, certainly be looking to your expertise locally for all the great things that you've done and incorporated as we're thinking about and planning for the next phase in recovery. What does it look like in the post-pandemic world? So I don't see any more questions that have come up in the chat, and we have gone over time a little bit, but I'm so thankful to the both of you for your continued leadership, the continued creativity and amazing responsiveness that you've offered to your communities, and you've been great examples to the rest of the Commonwealth and all that you've done. And I'm thankful to know you. I'm thankful to call you my colleagues and friends, and that we're able to work together to address these real challenges. And I wish you the greatest of health. I wish all of those that are participating in great health and care this upcoming new year. Hopefully 2021 brings us some positive advances. So, and some top opportunities to be adaptive and responsive. So thank you both. And,
thank you.
Thank you, Kathy. Thank you, everyone.
All right.
Thank you for
Thanks
the
for joining us.
opportunity.
All right.
Take care.
Bye now.
Bye.